Hello, learners. Welcome to today's topic in HIV management. Today, we are talking about opportunistic infections. Opportunistic infections. So these are infections that occur more often or are more severe in people with weakened immune system than in people with the healthy immune system. So opportunistic infections, these are infections that takes advantage because of a person has a lowered immune system, or the immune system is low. So when people have a healthy immune system, still there are some opportunistic infections that takes advantage, but it is not often and it is not common because their immune system is healthy. But when someone has a low immune system, like children and the elderly people, they are more prone to they are more prone to opportunistic infections. These opportunistic infections are different. There is such as diarrhea, tuberculosis, STIs, and many more other infections that takes advantage because of low immune system. As you are aware, immune system defends us from other unnecessary infections. So groups of communicable diseases in which sexual contact is the most important mode of transmission. So when we talk about opportunistic infections, we are also talking about communicable diseases. So communicable diseases, these are diseases that we get from other people. Non-communicable diseases are diseases that we cannot get from people. We can just have them, such as, for example, diabetes, hypertension. These diseases, you cannot get them from any other person. But communicable diseases, you can acquire them from someone. For example, a cough. A cough is a communicable disease because you are able to contract it from your friend who has a cough. Same here. The most common disease is sexual contact. So sexual contact or sexual transmitted diseases are easily catched because of the sexual behavior around people. Importance: increasing incidence worldwide. So when we check about this, why we are so much interested on sexual diseases or communicable diseases that we contract or that people contract through sexual contact, it's because it increases the incidences, the happening in the world. Then the cost and the difficulties in the treatment of diseases and their complications. So sexual transmitted diseases are more expensive to treat, and they are difficult to treat because they tend to recur, especially in married people or people who have a higher sexual activity. It is a socio-economic problem as well as behavioral one, since it is linked to additional low levels of religious values, increased age of marriage. So here, simply, when you look at sexual transmitted diseases, in low income places, it is where you will find a lot of STIs because sexual activity is common in people that have a low income, people in the compounds, communities. That's where you will find sexual transmitted diseases more often, because people who are found in Mayadi, the high class and so forth, their sexual behavior is low because most of the time they are busy. But people in the community, they are mostly free, and how they interact, it's at a tavern where there are a lot of them. And even the way they do their sexual activity does not matter as long as vachita vachitika kwasira. The other thing is that it is also found in low levels of religious values. Most people in our community, yes, they go to church, but the value of Christianity or Islamic or the value of their faith is not practiced. There are very few people who practice the value of their religious faith. That's why they find themselves so much into sexual indulgence. It also increases the age of marriage. So when you look at increasing the age of marriage, people who are oftenly having sexual activity, it's rare to fall into marriage. That's why early marriages in rural areas occur because people want to have an identifiable household or husband or wife, because in the village setup there are few. But the people, for example, in Chaisa, there are a lot. So you can sleep with this one, you can sleep with that one, you can impregnate this one, and that one can impregnate you, and so forth. As a result, people don't tend to take marriage as a priority, but sexual activity is taken as a priority. By the time one will think of marrying, they will be already up the age of marriage. So a lot of people are found in sexual activities. They have children, but they don't have husbands. They have children, but they don't have wives. So these opportunistic infections comes in different ways, and they are also infected, or the infectional causative or the causative organism of the infection is different. So there is some which comes because of viral infection, like AIDS, genital herpes simplex, genital warts. So as we go on all these conditions before we finish HIV management, you will know them one by one, because you need to know even how to handle them. Then we also have syphilis, gonorrhea, gonorrheal urethritis, chancroid, non-specific vaginalitis, granuloma. You also have trichomonas, vaginalitis, and urethritis, scabies, pediculosis, pubis. These are caused by parasitic, and the other ones, they are caused by bacterial. And those caused by fungal, we have vaginal thrush. We also have vulvovaginitis. So you will know all these one by one. Then we also have balanitis. So I'll be taking like one condition, we learn about it and so forth. And the other conditions, I'll still ask you to be going through these conditions. So just use the same with this one, this PowerPoint, especially here where there are some classes of diseases. Go through each one of them and have an understanding on these conditions. So today we'll focus on syphilis. So syphilis is a worldwide disease affecting mainly the age group from 15 to 39 years. So from 15 years to 39 years, these are the most infected people with syphilis. If someone is an adult above 40 years and you find them with syphilis, probably they are still into sexual activity. But people from 15 years to 39 years, they are more sexually active. So even in the way they conduct their sexual behavior is careless, because they just indulge into sex anyhow or with any person without much focusing on the preventional methods. Married people or unmarried people, between this age, there are very few who stick to one sexual partner. That's why a lot of husbands will cheat their wives, and their wives will also cheat their husbands. But when they come home, they pretend to be faithful to each other while there is no faithfulness. So each one of them will come and they will defend themselves as they come to the hospital. But you have to know that at this age, they are sexually active, and it is the most critical stage. Recently, it was found to be increasing. When you look at the current data, syphilis is increasing, it's not decreasing. Causative organism. Syphilis is caused by a bacteria or an organ called Spirochaete, Treponema pallidum. Spirochaete, Treponema pallidum. This one in your exam is a must because you need to know the causative, especially Treponema pallidum. So it is delicate and is rapidly killed by drying, high temperature, disinfectants, and soap and water. So when one has syphilis, before the incubation period, syphilis is able to die through the said one, by drying. So when syphilis bacteria becomes dry, or if where syphilis bacteria is surfacing, it is dry, it will not survive. If there is high temperature, syphilis will not survive. When you use disinfectants, for example, you bath with maybe chlorine, or maybe chlorine is a closer disinfectant that we can use. And these other detergent soap like Protex, Hygienics, and so forth, they are all disinfectants, and they are able to kill this bacteria. And soap and water. So when you bath with soap and water, the bacteria dies. So even your clients, you teach them that after having sex, they bath with soap and water, meaning that if the person they have slept with had syphilis, definitely it will go. So bathing is not to bath your head or your mouth. No, it's to bath your genitally, which is the sexual organs, penis or the vagina. You wash it clearly, and the bacteria will definitely die. Even HIV in that manner, as long as there is no cut, it cannot penetrate. Okay? But I'm not asking you to be masters. I'm asking you to go and teach people. But again, when you teach them, be careful, because they can be practicing it. They can be practicing it. But you need to know these measures to help your clients better. Reservoir. How does it get to be reserved so that it's not killed? In man, untreated case is infectious during the first and second stages of disease. So usually 2 to 4 years. So when a man or a woman is not treated, definitely it's very infectious, because it can infect a lot of people before people know to say someone has a bacteria in them. So it's very dangerous during this period. So whoever is suspected to be to have contracted it, definitely treatment should be given. Then exudates of skin, mucous membrane, blood and body fluids, which is semen, saliva, vaginal and cervical discharges. This is where you can find syphilis stain. So when these things are involved, just know that someone can give or can contract through the mentioned things, like in blood. If the blood is contaminated with syphilis, definitely you can get syphilis. So even when you're in the hospital, be careful as you are working, don't get in direct contact with blood. Even any other body fluid, even saliva. Saliva is able to give you syphilis. Those who like deep kissing, you exchange salivas in your mouth. If your partner has syphilis, definitely you are also at the risk of having syphilis. Semen, which most of you like referring to as sperm. Sperm is a cell. So that cell is carried by the fluid called semen. Ija fluid yene mumaona ti sperm, si sperm ni semen. To sperm ni tung'ono simungatuone na menso. So the same that is very contagious because it carries the bacteria. Then vaginal and cervical discharge. Mostly, you want to people, yeah, the pressure of sex, definitely it needs a woman or a lady to secrete some vaginal discharges, the mucus that comes from the vagina. So the same that carries the bacteria and it helps the bacteria to survive most. Remember there I said if it is dry, it is able to die. Meaning that if it is in semen and it is also in vaginal cervical discharge, it will survive and it is able to stay there for about 3 weeks. Transmission. How do one is able to get infected? First of all, it's contact with open lesions. So lesions, these are wounds-like. Sometimes they're not wounds, but they look like wounds. So they look like wounds. These are the lesions. You can find them in the mouth. You can find them in the skin and so forth. So this can be through sexual contact, most importantly, mode. So people mostly they get it through sexual contact, like 80-90%. You can also get it through kissing. Contact with body having congenital syphilis, you can also have it. So if the body is reacting to syphilis, when you get in contact with it, you're able to get it. So those who like exchanging t-shirts, exchanging clothes, please, you have known that you have to stop because you risk yourself from contracting the same. If you are exchanging a t-shirt, you put on a t-shirt that someone wore who has the syphilis bacteria, then you are also able to get that bacteria. Contact with contaminated articles. Sometimes there are things around us which are contaminated, and when it has the bacteria, you're also able to get it. Congenital infection. So congenital infection is it involves the transplacement from the fourth till delivery. So transplacental. This means this is the time that a child is in the placenta until a child is delivered. From the time the child is 4 months formed in the placenta until the child has been born. Once if there is a mother has syphilis, definitely a child risks also to become infected. So not before, because treponema cannot pass the placental bacteria. If the mother is in the stomach, I mean the baby is in the placenta, in the womb, mostly people think that the mother and the baby, they exchange blood. No. Placenta, inside the placenta, the child survives alone. The placenta covers and protects the child from mixing let me say survival components with the mother. So unless if the mother's blood able to pass through the placenta, cause by the result of placenta abrupture, then the child can be at risk. But make sure that mothers are tested when they are pregnant. And if syphilis is present, treat them without exemption. Thirdly, it's inoculation of infection, contaminated blood and body fluids. These they are able they are able to keep the bacteria and you're able to become infected. Also talking about the way syphilis is channeled. You know, my diagram there looks small. It was not properly adjusted. So syphilis is in two forms. There is congenital, transmitted from mother to child. So like I mentioned at that time, meaning a child can get from the mother. And there is also acquired. Acquired meaning you can get it through sexual transmission, or you can get it through any of the ways we mentioned about. So also acquired is into two forms. There is early syphilis and there is late syphilis. So in early syphilis, there is primary, secondary, and early latent. Late syphilis, there is neurological. Neurological meaning the one that goes to affect the central nervous system, which is the brain and the spinal cord. So syphilis is able to affect the brain and the spinal cord. When it enters the brain and the spinal cord, the patient infected starts behaving as a mental patient. A number of mental patients were caused by the presence of syphilis. Then also cardiovascular. Cardiovascular, it is the heart. Syphilis is also able to go and affect someone's heart and the peripherals of the heart. Also gameous and so forth. Then also latent. So these mentioned, they are able even to occur at the same time, because they are all potential receivers of blood. So once the blood is infected, as long as it is able to reach all these organs, meaning these organs are able to be infected, and when they're infected, they will manifest. They will show some signs and symptoms. So this is just a natural history of syphilis, cause of untreated syphilis. Syphilis distribution of the organism. So like I mentioned earlier, this is almost the same. So this is how syphilis is distributed. It will enter, you can see the arrow here on top, the presence of syphilis bacteria entering the forehead skin, or the through the penis into the forehead skin. So when you open the forehead skin, there are what is called the target cells, meaning inside the tissue is small. So the tissues inside, because they are small, syphilis bacteria is able to pass and go into the blood supply. So when it enters the blood supply, it goes straight to the brain to affect the brain, and it enters the veins in the brain. From there, it is distributed into all the organs. You can see down here, there are some organs like the skin, the kidney, the liver, the ear, the eyes, and also the brain. So that is where the bacteria survives most and starts affecting a human being. So primary syphilis. You can see here like how syphilis affects a human being. So first of all, chancre at the portal of entry, firm, indurate, painless, and highly infectious ulcer. So you can see on the mouth of this gentleman how it is looking. So someone will develop a sore, which is also known as an ulcer. So it will develop a sore, like on the mouth, on the lips. Not every sore or ulcer on someone's lips caused by syphilis, but syphilis at its primary stage, it causes this sore and enlarged lymph nodes. So you see lymph nodes down the mouth, let me say on upper of the neck, there are some lymph nodes. And also on the armpits, we have some lymph nodes, which becomes infected and cause problems to a human being who is infected by syphilis, because syphilis goes to affect the lymph nodes. Then spontaneously disappears without treatment after 4 to 6 weeks. So it will disappear and you feel you are okay. Meanwhile, it is there, but it has just stopped manifesting because it is still generating itself and changing the shape. So when it comes back, it will now be called the secondary syphilis. Generalized skin rash develops. You can see the patches around the body, the mouth, the hands, and so forth. You can see how the person is infected, and also the involvement of other parts of the body spontaneously disappears within weeks or months, followed after latent period, which is years. Probably it now goes to the steady stage. So it can take years. It will appear and it will disappear for some years. After some years, syphilis will also reappear. And when it reappears, this is how now it progresses, which is late symptomatic syphilis. This time it becomes more symptomatic. Reappearance of symptoms, the same lesions, and so forth. Characterized by the occurrence of neuro. Neuro, remember when you hear neuro, just think about the nerve cells and the brain connection. And cardiovascular syphilis. Cardio is the heart. Vascular, it is the heart and the peripherals, meaning the veins and other components that works together with the heart. So it becomes infected by syphilis. And the other characteristic is lesions. You can see on the nose of this gentleman here, I don't know if it's a gentleman or whatever, you can see how the ulcer is. That is a patch, that is a lesion. And it is in different parts of the body. Diagnosis. Diagnosis means working on the problem. So first of all, you need to know the clinical history, clinical picture of the infection. Ask about the sexual activity of the gentleman. If the gentleman has been sexually active or involved in so many sexual activities, then it's definitely that you have to probe for syphilis. And also, if the person is ask about the partner's status. Is the partner also tested for syphilis, negative or positive? Ask about their HIV status. How is the HIV status of the patient? Most the patients will refuse to review. They'll just say they are okay, they are negative, and so forth. That is why it is your duty to test. Make sure if people are presenting with the mentioned signs and symptoms, request for a direct counseling and testing for HIV and syphilis. Secondly is laboratory investigations. A demonstration of organism in exudates of lesions by dark field microscopic exam. So when you check on the microscope, this picture here, that is how HIV looks like. So that is how syphilis lesions looks like. So when you go to the hospital, you will pass through the lab. This is what you have to see. This is what you have to see to confirm for syphilis. But this time we have the rapid test for syphilis, which makes it more easier and more simple to catch the infection. So here is just the way of testing and the stages that you have to use to test. But I know as a counselor, you have already known what a false positive means, what a false negative means, and what should be confirmed, and so on. So I will not waste much of my time here, but instead, I will also remind you that testing nowadays is using a RDT, which is a rapid diagnostic testing kit. How do we prevent syphilis? Prevention. Genital measures. 1. Avoidance of sexual promiscuity. So you have to avoid most of the sexual ways or sexual interactions, in short. Even some people like sucking the vaginas, the penis, and so forth. You have to avoid those things, or even just the direct sexual contact. You have to avoid. Health education to increase awareness. You have to educate people. If people don't know, definitely they will practice a lot of things unknowingly, and so forth. So people should be educated. Make sure that you educate your clients all the time about syphilis and about other sexual transmitted infections or diseases. Then religious and social guidance, especially of youths. So mostly these youths, even in churches, they have to be taught about STIs. They have to be clearly taught. They have to know, because as we said, from 15 years to 39 years, there is so much sexual activity among the youths. So they have to be taught according to the religious. Religiously, it is known that sex out of marriage or before marriage is a sin. Remind them so that they can have some limitation. And also, they need social guidance. Social guidance is more important, because whenever someone is growing up, you try to do things and experiment. So when there is no one to guide you, definitely you will experiment things in any manner that you feel is right for you. So it is important to guide the youths on how they have to play with their life socially. Fourth, convenient family life and supervision of youths. So family members also have to take their role to supervise the conduct of the youth. Mostly, especially female parents, they like encouraging, or rather shooting the children. When you see your children have become playful, they've become so much to play with the opposite sex, please stop them or guide them in a way that it should not indulge them into early or premature sex, because that is the time they can catch it. At 15, you can see at 15 someone can catch syphilis. Syphilis can be born with, but those who contract it, mostly it's 15, because 15 years, that's when the sexual activity starts in especially male children. Female children, they start as early as 12 years. So by the time they're catching 15, they are snipers, or rather they are experts. They are experts, because they are at that age, wanyamala bakuru bakuru baningi, oyopa. So they need to be guided by the parents. They need to be under the supervision of parents. Youth needs to be supervised in everything relating to sexual issues, sexual and social matters, in short. The fifth one is suitable places for leisure time and development of hobbies and talents. So mostly people just like, maybe at my leisure time, I like going to the bar. Sure, a bar, is it a suitable place? The answer is no. No, at my free time, I like going to see my boyfriend. For what? Any male or female at that moment, when they are visiting themselves at a free time, just know that there is a sexual activity that is taking place. So you need to check how you spend your free time, especially. If you spend your free time with an idle mind, definitely you will fall into such calamities and so forth. People want to visit their boyfriends, even married people. How you spend your free time also matters. So as you are educating them, do not think because they are married, then talk about their free time. One thing I can assure you is that people who drink alcohol, whether male or female, whether you drink in a time, once you are drunk, you become sexually hyper, meaning you become sexually high, and you become loose to sex. Anyone can have sex with you. So most people use their free time in the bar, drinking. Once they become drunk, they become potential sexual instruments, or rather sexual participants. And that is the most critical time when people contract these diseases, sexual transmitted diseases. Even your hobbies matters, your talents matter. Some talents, they take you to these activities a lot, but some talents will isolate you from such activities. Socio-economic development and provide facility for marriage. So even socio-economic, people who are prone to sexual transmitted diseases, mostly, they are those who come from a poor economical status, because all they will have is sexual activity to help them to be supported and so forth. They would rather exchange sex for money or support. Even provide facility for marriages. You know, people just indulge into marriage without counseling and so forth. So it's your duty also to see that people have a way which they can be able to have their marriage cancelled before they go into marriage. Like churches, you can have some marriage counseling groups. Even you, after you graduate, you can open one for yourself. Not just for business. I know there's good money, but not for business only, but also to help in reduction of such infections. Be specific. Chemoprophylaxis. So when you look at chemoprophylaxis, these are chemicals. Prophylaxis means the treatment. Chemo means chemical. So one dose of 2.4 million units of long-acting penicillin. This is initially the way you can treat. The way you can treat, because if you have not put yourself into penicillins, you are able to, most of the times, in short, we're exposed to the infection because we don't know what we touch. We don't know the contamination that we have gone across to. So after some time, probably 6 months, 1 year, or so forth, you should at least be injected for prevention, because a prophylaxis doesn't mean you are being treated because you are sick. No, you are getting the drugs for prevention or for possible treatment if there is an infection, or if you are exposed to the infection. People who are raped, they have to be given this injection, the penicillins. They have to be put on prophylaxis, which is the prevention and the treatment of exposure. Even you, when you are working, after some time, request so that you are given in case you touched the blood that is contaminated and so forth. After some time, just request so that you are also prevented. The specific treatment, long-acting penicillin, which is 2.4 million units in a single dose. So this is the penicillin. These are antibiotics. It's a type of antibiotics, which, as you go in the hospital, I know it's a duty of nurses and clinical officers, rather clinicians to prescribe, but you also need to have an understanding of it. So these penicillins are drugs such as doxycycline, benzathine, benzyl penicillin, and so forth. So these usually, if it is benzyl penicillin, like for example, benza, you have to be given one, which is 10 mils, 8 to 10 mils once per week for 3 weeks. So that's the one which people refer to as the painful one. But cancel them so that they can have the injection. Doxycycline, you get 100 milligrams twice per day for 14 days. Then you also can get Ciprobid. Also, Ciprobid is 500 milligrams twice per day again for 14 days. Then after that, you have to be re-examined after the treatment. And when you are treating for syphilis, make sure that you are treating the husband and the wife. Don't just treat one person.